I'm going to talk to you a little today about practicing medicine in black communities and some of the challenges that you may not know exist. First of all, just to give you a little background, I have practiced medicine, primary care, and emergency medicine for a total of about 7 years in black communities. So I've been around. Sometimes people can think that doctors are going to be successful no matter where they are. They'll have the misconception that the doctor is going to be rich. He's making money. Or she is making money. But in these black communities, it's a different story. You see, in the black communities, which are for the most part poor, if you go to the rural communities, even some of the cities, a large number of your black patient base and a large number of your black population of those rural communities, rural cities, are going to be receiving some sort of government assistance. And they're going to be receiving, usually, government assisted medical insurance or Medicaid. Remember, Medicaid is aid for the poor. That's how it works. Medicaid is for the poor. Medicare is for the elderly. So what you don't realize is how Medicaid reimburses the physician. So let's just say you have a clinic out in the middle of somewhere in rural America, rural city, and you have enrolled, let's say, maybe 1,000 or so Medicaid patients. Well, Medicaid reimburses you approximately $35 for a visit. Now, I'm giving you approximate now. I think it's around $33.67 or somewhere, but I'll just make it round it off. It's around $35. That's what you get paid as a primary care doctor per patient visit. Okay. Now, remember now, Medicaid only gives these patients, in a lot of cases, a certain amount of doctor's visits per year. So it's not unlimited. They only give them a few, visits per year. All right. But in any case, your reimbursement is going to be around $35 per visit. So let's do the math here. Let's say you saw, if you see roughly 30 patients a day, all right, Medicaid patients, that would be right at, I think, right at around $1,100, something like that. So that's 30 patients, though. That's 15 patients in the morning, 15 patients in the evening. Now, you got a lot of physicians that are high volume clinics. They like to see, 50, 60 patients a day. But I got to tell you, you may be seeing 50 or 60 a day, but, there's something there's something not going to be fully addressed in those types of clinics, okay? It's kind of like a stop and go. So don't believe the hype on those. But there are a lot of guys that do that. But even still, let's say you saw 30 patients a day, which is a full day. $1,100 per day. You'd just about be breaking even after you've paid your staff, you paid your supplies, you paid your taxes, their rent, your electricity. You'd just about break even with $1,100 a day running your own clinic. Okay? That's with Medicaid now. It's a full day. 30 patients a day, I would say, is a full day. You know? So let's just do the math. Let's say you worked, you can't work all 30 days, but let's say you did work 30 days. All right. Let's say you bring home $30,000 a month. That's what you grossed. All right. And you may have 2 to 3 employees. They're going to be making somewhere around, $10 an hour or so. You have to pay their insurance. You have to pay your payroll taxes. And if you have a billing and coding or a biller or coder there in the office, she's going to be on salary. Or you can use one of these companies that come in and just do all your coding for you, your billing for you, but they take a percentage of the total. It could be somewhere between 8 and 10% of the gross. All right. After you've paid all of that, overhead and all those bills, you just about bring home about $5,000 to $6,000 a month. Now, for me, that's just not worth it. You got to understand, too, when you're in these communities, even though it's a good thing, you're doing a noble thing by practicing in this community and, serving this community with your, ability to practice medicine. You do need to understand that you're in a population that is going to probably be more likely to sue you. Okay? Even though you're doing a noble thing by just being there. And I had to learn this too. You got to understand the culture of black people. I'm not putting them down. It's just a reality. This is something not up for debate. This is just the way it is. They don't view you as a integral part of the community in the mindset that you need to be protected and kept in order to continue to be able to serve them and provide them medical care. They don't see you like that. They see you just as a utility that they can use when they need it. Now, I'm telling you, it's very important that you get this. I hope you understand what I'm saying. You see, you carry a specific value as a medical professional in these communities. You really do. But only you know the real value. When they see you there, it's just like they just see a resource that they can go and access when they need it. But they don't see the the value in protecting you and keeping you and elevating you as something, as an example for the community. No, they don't see you like that. They just see you as a utility. And if you get too friendly with them, see, you make yourself too friendly, they'll start coming to your house if they know where you live. You know, they'll call you. If they get your phone number, they'll call you middle of the night. You're just a utility that can be used. And this, when I realized this is what brought me into the consumer mindset knowledge that I have now about the Black culture. You see, you got to understand how Black people see other Black people. See, you as a Black man, no matter if you're a professional or if you're not, you carry with you the presumption of disorderliness. In other words, when people see you, before you open your mouth or before you're able to even show what you're able to do, they presume that yours is going to be a lesser quality product just on the basis of your skin. Now, I'm sorry. I'm telling you, this is the way it is. Don't think that it's not that way. The presumption about you, before you're able to even show what you're able to do, is that you are going to bring a lower quality product. And because of this, you're not respected. See, you carry with you the presumption of disorderliness. See, and the white people, white culture, or let's just say a white doctor or an Asian doctor or an Indian doctor, okay, they carry with them the presumption of orderliness. So they're going to get respected higher than you. See? So now you can gain respect by going in and after giving you an opportunity to show what you're able to do and you do a good job, you will gain respect. That's how you'll get respected, by word of mouth. But the presumption of you is going to be disorderliness and a lower quality product. And it's because the culture that you come from is mainly a consumer-minded culture. It doesn't value order. It just values consumption. And even though you may be an orderly man, an orderly Black man, you're still Black. And that those cultural stereotypes, those cultural labels, they go along with you. You can't fight it. You just need to know that that is what comes along with the picture, even from your own people. So no, they're not going to respect you. Not for what you're able to bring to the community. They don't respect you for that. They see you as a utility. That's it. Now, after you learn this the hard way, you will decide whether or not you want to stay in this situation over here. Hopefully, that you'll have an option where you can get out. Your record won't be destroyed before you can get out. And if you have the option to get out, I would suggest just working as a independent contractor, locum tenens doctor, doing just kind of floating around from clinic to clinic, emergency room to emergency room, or urgent care clinic to urgent care clinic. You'll make a good living. Your money will be better than what you're making working every day in that clinic as your own clinic. And you'll have a life. And when you work in a locum tenens, an independent contract type situation, it removes a lot of the preconceived choices that people would have made if you were a standstill doctor or you had your own clinic. Whereas if you go work in a locum tenens situation, they can't choose. See, they're going to see who's there, and that's going to be you. So just keep that in mind about going into these small communities. You may have a good intent. Your heart is in the right place. You want to help these small communities, but you do need to know how you're viewed. See, you know your value, but they have a different spin on your value. Your value to a consumer-minded person is just there to be used when we need it. It's not something that we need to preserve. See? And that's how they see you. So just keep that in mind. I want to share that with you about going into these small communities as a physician and knowing the good and the bad.